All right, so any type of knee injury that you're recovering from, many times you're going to feel that stiffness or fullness within the knee joint, in which case full knee flexion can be a little bit more restricted. You might be apprehensive to get into that deep squat. And that is going to lead to some pretty nasty things when it comes to high reps or high loads. We're going to have some sort of compensation hip shift. So if we can mitigate that by having a nice fluid, pain-free, restriction-free knee flexion, we want that. Nice little technique I like to use. It's almost like a scoop technique. I'm going to use a lot of my body for this. So I'm more or less going to double stack my hands. I'm going to put it right, not in popliteal fossa, but just kind of inferior or down from it. And I'm more or less going to scoop that gastroc or that calf muscle a little bit. And I'm going to create a nice little barrier. And here, I'm more or less going to lean my body into it. What this is doing is this is screwing around with a little bit of the physics. The axis of rotation is now about my hands and not the knee. So the knee gets a little bit of a distraction piece. This feels pretty good. And I can do this for a few minutes. What this is going to do is, once I'm done with this, we're going to retest it. We're going to put him into a nice deep squat, and he is going to feel a significant difference right away. And from there, 5 minutes of this leads to a lot more loading responses without compensation. I think that's a huge win. So ask your therapist to throw this into the mix, show them this video, or better yet, just get onto our schedule and let us take care of you from here.